explain my vote.
Please.
I'd like to read aloud a letter that I got permission to read from a mom. She says, "My name is Terry, and I'm the proud mom of a trans son. He is 19 years old, living the joyful and productive life of a college student. He was treated with puberty blockers and is currently on testosterone. Both these treatments have been essential to my son's health. I would like to make clear that no treatment was done without careful consideration by our family and his medical providers. It is a myth that trans youth have easy access to puberty blockers, hormones, and surgery. Unfortunately, access to health care is a challenge for everyone. We had several appointments to allow for the medical provider to carefully and thoroughly make recommendations that were in the best interest of my son's health. My husband and I then made sure we had researched the recommendations to be sure there was no question that the treatments recommended by the provider were not only the standard of care, but also founded on evidence-based medicine. Once we decided to move ahead with puberty blockers, we had to contend with obtaining prior authorization from the insurance. It was not an easy task, to say the least. This and other barriers were everyday occurrences for both trans and cis individuals. This bill will only compound existing barriers to health care, thus limiting access to vital health services for trans youth. Senate Bill 1586 poses a critical threat to the health and well-being of trans youth in Arizona. It will essentially deter medical providers from providing necessary medical care to trans youth. If this law existed when my son was younger, I can say without a doubt he would have been severely impacted. He would not have been a healthy teen, nor an honor student, a youth mariachi, and a brown belt in karate. I strongly urge you to reject Senate Bill 1586. Please give other trans youth the same opportunity to receive the health care they need. They deserve the same access to health care as cis youth. Allow families to see their trans youth grow into thriving, hardworking citizens who contribute to society for the greater good of all Americans. And I vote nay.